Hi everybody. So in this session we are going to discuss about medication order and prescription. So as a nurse we are supposed to go or have a close watch on what we are seeing on from a medication order. Might be from a physician, consultant or surgeon. So as we being a nurse, what are the things can be followed or should be followed whenever a medication order is being received onto our hands. So, coming to the introduction order, like a medication order is a written instruction, or it can be on an electronic base, or even it can be through a verbal command, oral, which is always given by a licensed prescriber, whom we call as the consultant, the physician, or might be the surgeon. And the specific medications is being ordered in order to improve the patient outcome or to improve the patient status of well-being. So in short, we can say that medication order is a written instruction or it might be an electronic instruction or a verbal instruction which is always prescribed by a licensor, and this is mainly focused on the specific medication what we give, and it's only for the patient for his recovery or prevention of illness. Coming to the elements of a complete medication order, as we the nurses, what are the things to be closely monitored when we receive the prescription? First and foremost, see that whether the patient's full name is being entered, and always do the identifiers, patient name and the OP number or the IP number. Next comes the date and the time of order, whether it is a fresh prescription, because nowadays you can see that many of the patients what they do is that they get prescribed might be 3 months before they had of course like common cold, or might be a severe cough, or it might be any upper respiratory or lower respiratory infections. So nowadays these patients what they do is that they preserve the prescription, and the next time if they have the same symptom they create a habit of using the same prescription. So that's the reason you always counter check whether it is a fresh order, checking on the date and the time of order. Then, of course, the medication name must be very clear, no doubt in that. Like there are some of the drugs which you have look alike and sound alike drugs. So, in those cases, you cannot take risks. Always be very specific that the name of the drug is given in bold letters and it is clearly visible, so that you don't have any dilemmas on whether it's the right drug or not, like dopamine, dobutamine, or might be Lasix, or any sort of lookalike or sound-alike drugs. Then, of course, you have to check what's the dosage, order dosage. So you have to prepare the exact dosage which is needed for the patient. Might be you have an ampule or a vial which is having around 500 milligram or even 1 gram. But whereas the order is given only the half of the dose. So it is our responsibility to load the expected dosage which is being given by the doctor. Then the route of administration, whether it is through IV, oral, or IM, or subcutaneous and so on. There are certain drugs where you cannot give through IM. There are certain drugs where you cannot go for direct IV. There are certain drugs where you cannot go for oral. So depending whether the exact order is given, and you have to mentally and physically prepare the drug, and then you plan the site of administration. Then frequency of administration, like whether it is a OD dose once a day, BD dose twice a day, TID thrice a day, QID 4 times a day, STAT order STAT, so at once, PRN drugs whether it's necessary, or many of the frequency is to be closely monitored before you give the drug. Then, of course, we being the nurses, why the drug has been prescribed for this particular patient. So we can counter check with the diagnosis of the patient, with symptoms of the patient, to be very specific on the purpose of medications. Then comes the prescriber's signature. Of course, along with this, might be if he has this medical number, So that number or employee number, so that you are on a legally firm base. That is, you have that, there are no doubt you're going to give the exact drug which is being prescribed by a physician. Then of course, if necessary, there are any special instructions which is given by the doctor must be taken into account, and you fulfill the necessary special guidelines. So these are the common elements as a nurse we have to closely check on, right? Starting from the name till the special instruction. Next, what kind of order you can receive? As I told you, standing order, PRN, whether it is necessary based on assessment, OD dose, start dose immediately at once, now order, whether it is on time bound. The prescription process, you know, the prescription process, the prescribers writes the order. In the prescription process, you can see the prescriber will be, it is always being created by a licensed practitioner. He will be writing the order. Once the order is written, it is being sent to the pharmacist for purchasing the drug. And once the drug is being purchased, then from the pharmacy, the pharmacist dispenses the medication. And finally, the patient receives the medication. But see that whenever the patient receives the medication by himself, or it is through the family members, counter check must be done before the patient is sent out of the hospital. So the valid prescription components would be prescriber's information, patient information, date of issue, super subscription, inscription, subscription, signa, that is the signature, and refill information and prescriber's signature, and DEA number. The legal considerations that should be kept in mind as a nurse is that the Nurse Practice Acts, Controlled Substance Acts, Medication Errors, and Documentation. So as we, the nurse, see that whenever we give the drug, we have to take the accountable and responsibility. And of course, in case if you are handling any narcotics, the narcotic drugs should be kept on a double lock and key, and that ampule must be preserved. And how much is being taken by the patient must be reduced into the narcotic drug note. And of course, as a nurse, we have to prevent medication errors just by counter checking whether the patient is a known allergic case. If not, for all the antibiotics or for all the emergency drugs which we give in high dosage, a test dose may be given to prevent medication errors. And accurate documentation is very essential. So some of the steps to have a safe medication administration is that always verify the doctor's order, assessment whether the patient history is very potential according to the issues, preparation of the drug, if it is necessary, it should be done under aseptic technique and under proper procedure. That is, you administer the drug in such a way that there are no disruption, or you call it as a disturbances. Administration, you are going to teach the patient, educate the patient, and administer. After administering as well, you are going to have a close monitoring to check out the adverse reactions and report in case if there is any adverse reactions to the pharmacist, and of course patient education when they are moving out of the hospital to the patient as well as to the families. So these are the prescribed abbreviation list, or you call it as the standard list, such as I told you, ON or every night, OS apply on the left eye, PC after take after means PO only by oral, PR rectum, PRN as needed or necessary, PV take vaginally. Like that, you have n number of prescribed abbreviations that should be followed whenever we use the prescription. Last but not the least, a rapid assessment. Which of the following is an essential component of a valid medication order? Nurse's signature, patient family history, route of administration, nurse shift details. Which would be an essential medication order? Just think of. If a PRN order means medication must be given every hour as needed at bedtime before meals. So this is a clear answer that whenever necessary as needed. What does a start order means? That is, you're going to give the drug immediately. Which health professional is legally authorized to write a prescription? Of course, here the physician or the authorized prescriber. The abbreviation BID means twice a day. So these are the common answers which are given for the questions. These are the common references which I have used, and this is a small sample of we call it as the medical reconciliation card. This card is might be used for patient who are getting hospitalized, for a patient who are getting discharged and post discharge as well. So this will be actually having as a clear cut orders of what the patient had at home and during the hospitalization, and on discharge what are the drugs we are adding. And that's all for today. Thank you. Stay tuned for me getting more videos, and don't forget to like, subscribe and comment on my channel. Thank you.